Hi, Dr. John here with NBC News on this Facebook Live. Going to give you some updates on coronavirus and where we are in the pandemic right now, what it means for you particularly, and what you can do to help. On top of that, we're going to answer some questions you might have. So if you have any questions, please forward them to me. We'll get to as many as possible. But over the next few minutes, I want to particularly talk about a couple of different headlines that have come out over the weekend and last week or so. One of them is about our reopening and what that means across the country. And the other one is an example of a country that's done it very well. Granted, there are some reasons they've done it well that we can't duplicate here, but there's some lessons we can learn as well from all of this. So first, let's start with what's going on in the world right now. So around the world, there's around 4 million cases. There's around 7 million cases of coronavirus, around 400,000 deaths. That's the bad news right now, but that's a very, very large number of both cases and deaths around the world. And we're starting to see different areas that are cropping up. Brazil right now is having a lot of issues because their hospitals are being overwhelmed, and we knew this would move to the southern hemisphere. We didn't know how badly it'd be in the southern hemisphere, but it looks like it's kind of duplicating what happened in the northern hemisphere. Here in the United States, almost 2 million, 1.9 million cases with 111,000 deaths, a little over 111,000 deaths. We're still in the midst of the pandemic, and so it's very concerning to make sure that we all do what we know we need to do, what we've been touting over the last few months to keep it under control. Right now, what's happening in different parts of the country is we're seeing things reopen. Stores are opening, restaurants are opening, hair salons, bars, all those things are reopening. They're reopening with social distancing in mind, but we're also seeing an uptick in cases in these areas. In particular, some of these Arizona is having some issues, Texas, Oregon, other states, Florida's reported some issues. And what's happening is we're seeing as these reopenings are happening, the spikes in cases that we knew are coming about, or that would come about, are coming about. Now, the concerning thing, in some cases, Arizona being an example, is those spikes are starting to edge towards outbreak, and those need to be controlled. Because even though we know once we start reopening, we're going to have these spikes in cases, that's inevitable because people are going to get out, they're going to get closer together, they're not going to be staying at home, so they'll be more exposed to other people. That's how the virus spreads. So we are going to start seeing these spikes. The hope is we keep those spikes under control and they don't turn into outbreaks. And here's how we do that. There's 4 things we need to do. It's a box system. We need to make sure that we have good testing in place. And that means that we have adequate testing, both the diagnostic test, which is the nasal swab, or the antibody test, which tells us if you had it in the past. And that can tell us who might have it actively in the community or how many cases have been in the community over the last couple of months. And that can help public health experts determine where the outbreaks are, where we need to put in the certain allocations of resources to get them under control. So having that testing done is important. On top of that, if somebody tests positive, you want to be able to isolate them. Third thing is contact tracing. So if somebody's positive, you contact trace who they've been around for the past few weeks. Those people, the 4th part of the step, need to quarantine, stay home for 14 days so it doesn't spread. So that is what needs to be done. That's what public health officials will be doing. As for the rest of us, what we need to do are the things that we've been doing for the past couple of months. Wearing masks, social distancing, going out more so than we've done in the past, but still with an eye on not being around large groups, not being inside that 6-foot bubble we talk about, because that social distancing is going to be important. If you go to a restaurant, what I tell people is the table should be 6 feet apart. You should be with your group isolated in that table, another table 6 feet apart. If they're not 6 feet apart, I'd probably turn around and go to a different restaurant. The other thing is, if it can be outdoors instead of indoor dining, that's going to help, because we do know in the outdoors it doesn't spread quite as much. But there is one concerning area, and I'll talk about that in a minute. So having a seating outdoors can certainly help versus having it indoors. And obviously, if you're having any symptoms, if you have any concerns, or if you've tested positive for coronavirus or been exposed to it, as in somebody in your house had it recently, then you need to not do those things so it doesn't spread. But now the concern is, okay, with all the protesters around the country, they're returning back to their communities. What does that mean? And the answer is we don't know. But most experts think that that means that they're going to start spreading coronavirus around a little bit. The confusing factor is it going to be because of reopenings? Is it going to be because of protesters returning? Is it going to be a combination of the two? We're not sure, but we do think, again, we're going to see these spikes, and we need to keep these spikes from turning into outbreaks. That's probably the biggest thing to understand about that. On top of that, the second headline I want to talk about is about New Zealand. They're opening up their country. They're the first ones to basically say, okay, we've whipped coronavirus right now. They have no cases, have reported no cases over the past few days. and they're saying, you know, we've got it under control. So what they're doing is they're opening up their country, schools, restaurants, everything is opening up. People can start getting together again. With some caveats in mind, of course, of realizing that social distancing is important. They need to keep things under control. On top of that, they're keeping their borders very well controlled. They're not letting anybody coming in from outside unless you're a resident who comes back. If you do come back as a resident into the country, then you do need to quarantine for 14 days, and that's a mandatory one. They're keeping a very close eye on it. So how did they get things so well done there, and what's the lessons for everybody else? Well, they ended up with their first case around March 14th. That's when they had 6 cases. And over the next couple weeks, they shut their country down almost completely. Everybody was mandated to stay home over the next couple of weeks. They basically could go outside for exercising, and that's about it. And they kept everybody indoors, kept all the businesses shut down, kept the borders controlled for a long period of time until just recently when they started opening things up a little bit more. Now, granted, it's much, much easier for a country of 5 million that's an island to do that than a country of 320 plus million that's a huge continent to do that, or not quite a huge continent, but part of a continent to do that. And so there are some lessons we can learn from them, though. And one of the lessons, probably the biggest one, is contact tracing is extremely important, and how fast they jumped on shutting things down. I think those are lessons we can go forward with here, because one thing we do know, again, to prevent these outbreaks, if you start seeing cases, you might need to regress a little bit and start shutting things down again, start that social distancing, starting those measures, because if we can start them early, we can do them for less of a period of time and we'll have less people impacted. And I think that's the key here going forward. On top of that, that contact tracing, they're doing it in a system-wide fashion there, contacting people by phone, keeping them at home, and making sure they stay under control and they keep the virus under control. Big important thing. So again, a couple of things to think about. We're reopening around the country right now, different areas, and that means making sure you keep an eye on staying safe when you're out there, because coronavirus is still here. We're still in the midst of the pandemic. We want to make sure we get through this all together. And then looking at New Zealand, again, it's a country, you can't duplicate everything they did here in the U.S., but there are some things, particularly contact tracing and shutting things down very early if we do start seeing cases. So now let me see if we have any questions here.
I was in a protest. Should I be tested?
So the question is, I was in a protest, should I be tested? And the answer is yes, you should be tested, especially if you're going back to a community where, if you came from a place that's a quasi or a hot spot, as in New York City or some other big cities, and you're going back to an area that's not, you want to make sure that you don't bring it with you. Getting tested is important. At what point do you get tested? Right now, most experts are saying around 5 to 7 days after the protest is when that test should be done, because that's when it's most likely to be positive if you do in fact have it because of the protest. Now, this doesn't mean protesters are going to take it back. This does not mean protesters are going to spread it. What it means is we need to be careful that they don't do that. And so again, if you're in the protest, recommendations, especially like in New York City or other areas like that, is you do get tested at the 5 to 7 day point. If you're positive, obviously do the things you need to do, isolate yourself. If you live with somebody who's vulnerable, that's somebody above the age of 65 or older, somebody with pre-existing medical conditions, then you want to, especially if somebody has autoimmune issues, probably want to think about staying somewhere else for a couple of weeks or until you get tested, just to make sure, because we know up to over a third of people with coronavirus don't have symptoms and can still spread it. So, and often you can spread it before you know you have it. So it's important to make sure everybody stays very safe through this time period.
What about flying again? Is it safe?
The question is, what about flying again? Is it safe? Anytime you go outside, anytime you go anywhere and do anything where you're outside of your own bubble in your house with your quarantine team you have there, most people, that means your family members, then you're risking catching the virus anytime you go out there. And so there's a difference between it being safe, which anytime you leave that environment, it's not going to be completely safe, but you want to make it safer, as safe as you can. And what that means are taking measures to make sure that it is safer. On the airlines, they're doing a lot of cleaning, and so that contact surface spread that we talk about, getting it from touching something and touching your nose and your mouth or your eyes, that doesn't happen quite as often as we thought it did, and they're cleaning it so it should be even less likely to happen. Respiratory issues, that's a big thing, especially on airplanes because you're in such close proximity to each other for extended periods of time. Wear a mask. That's the thing you can do to protect yourself and other people. Now, wearing a mask protects other people from you more than it does you from other people, but if they wear masks as well, you get that protection back and forth. Caveat being here that a lot of airlines are not enforcing masks. They're not mandating masks, and so you'll see, I took a flight recently where not everybody was wearing masks on the flight. And so you just have to be extra careful. Make sure that you have your mask on in place. Make sure you wash your hands frequently when you're going there. And then just take care of yourself on the airplane as best you can. But as far as flying, safe right now at this point. Not completely safe, but safer than it was before. But again, you have to take certain measures to make sure that you stay safe as well.
Does heat have an effect on COVID-19?
So the question is, does heat have an effect on COVID-19? And I'll expand that question a little bit more. Does heat and humidity have an effect on COVID-19? Because a couple of months ago, we thought, okay, the summer's going to come here, COVID-19 is going to get better under control, and well, the heat and humidity will help kill it, so we won't have much of an issue with it. Well, it turns out that's not as likely to happen as we thought. Heat and humidity seem to have a little bit of effect on COVID-19, but not a complete effect. So this is not going to be like your regular coronaviruses or flus that we have had for the past, as long as we've been alive, which essentially in the summer die off, come back in the winter again because they're cold weather viruses. This virus has an ability to survive that heat and that humidity to a certain extent. So this summer, it's not going to completely go away. I think it's going to get less. It's going to be kind of an undercurrent of coronavirus staying here. And then once the cold weather moves back in, it's going to come back again. Part of that reason is because once the cold weather moves back in, we move back indoors. If we're with our quarantine team, then we're isolated with people that we know are healthy. But at the same time, if we're outdoors, if we're out and about, cold weather makes our nose run, makes us cough and sneeze more. The virus is more active in cold weather, and that's part of the reason that it seems to spread more in cold weather. So heat and humidity help a little bit, but they're not going to completely eliminate it. So during the summer, you probably have to do those same measures to keep yourself and your family and your community safe as well.
Is it true that COVID-19 is starting to mutate so that symptoms are not as severe or less aggressive? So the question
is it true that COVID-19 has mutated to where it's a less aggressive virus, so we don't have to worry as much about it? The answer is no. So the reason this question was asked is because there were some doctors and scientists in Italy that said they were seeing a virus that didn't seem as virulent, didn't seem as aggressive as the original COVID virus that they saw a couple months ago. Digging into the data, other experts are saying, hold on a second, that's not what you're seeing there. What you're seeing is that fewer people are getting it because, one, it's gone through the community very hardly, so fewer people are getting it. On top of that, the people who are getting it tend to be healthier people, so they have less symptoms than the other people who got it who ended up either dying or getting critical symptoms from it. Those are typically older people. That was the first salvo in Italy. This next salvo we're having right now are people that tend to be healthier so they have less symptoms. That's what you're seeing. But the virus that they've looked at, especially on a genetic level, has not, the word is significantly mutated. Now the big key here is viruses are constantly changing. Even coronavirus, from what happened back in December, January until now, it makes little bitty changes, but those changes are not significant. In other words, they don't make it a different virus, they don't make it less virulent, they don't make it less aggressive in our bodies. They just make it a little bit different. And so I tell people it's the equivalent of putting on black shoes instead of brown shoes, or putting on an orange coat instead of a blue coat. It's not going to change what that does for you. It just changes the look of it to a certain extent. And so don't think that the virus has mutated to something less contagious, less virulent, as I say, less aggressive, because it's still the same virus. It's just in Italy, they thought that's what they had seen, but most experts are saying that's not what they had seen at all. We still need to be careful.
Can you get COVID-19 more than once?
And the question is, can you get COVID-19 more than once? At this point, no, and that is good news. And so what we're finding out is people who had COVID-19 ended up recovering from COVID-19, and they're not getting it a second time. Reason they're not getting it a second time is their body builds up these antibodies that protect them from COVID-19. And we think that's good because if you heard the question I just answered, this virus has not mutated very much at all. And so if it hasn't had any significant mutations, like this one has not had significant mutations, then our antibodies are going to protect us from COVID-19. Question is, we don't know how long it's going to protect us from COVID-19. Some estimates are up to 2 years, some estimates are around 6 months, and that's why the vaccine is important. On top of that, part of the reason for the question, I think, is because we've heard in different countries, and including here, and especially the USS Roosevelt, there were sailors on the USS Roosevelt that ended up having coronavirus. They recovered from it, and weeks later they tested positive again. In South Korea, it was the same thing happened there. What they're finding out is they're testing positive because of the nature of the test. This is a PCR test. It's called preliminary chain reaction. So what happens is it amplifies the RNA, in this case, from the virus. And when it amplifies that, it can detect it. Because it's amplifying it, It's finding these dead particles of the virus and amplifying those and showing up as a positive test. But when they tried to grow the virus in a lab, it didn't grow. And so that means that this virus is not a contagious virus. At this point, it's not an active virus. It's just dead particles the body hasn't cleared out yet. So it's not a second infection. It's just a second positive test. And it's a bit confusing, but there's a huge distinction there. So the answer is no, you cannot get coronavirus a second time, at least short term. Long term, we're not very sure.
In the UK, vitamin D has been recommended for citizens. Why aren't we doing the same?
So the question is, how come we're not recommending vitamin D for citizens? And the question here is, in the UK, they've recommended it for citizens. I don't know if the UK has recommended it. I'll certainly have to look into that. But the reason we're not doing it here is because what the studies are showing is that we know if you have a vitamin D deficiency, your immune system is not going to work very well. By that, we mean people that have severe deficiencies of vitamin D, their immune system is not going to work very well. Most of us have either adequate vitamin D or a little deficient on vitamin D, don't really need a whole lot. And so taking huge doses of vitamin D, which are some people are advocating that, it's not going to do you any good, and it can have some side effects to it. And so it's not really going to do much more. The people who vitamin D issues worked for were people who had severe deficiencies of vitamin D and were given large doses of vitamin D to try and counter that, and they ended up doing better that way. But for the average person, vitamin D was not an issue, and so vitamin D supplementation is not an issue. The fact of the matter is, too, plus here in the United States, we have plenty of sunlight in most areas. Getting 15 minutes of sunlight can give you all the vitamin D you need in a day. Of course, the caveat being, putting my public health hat back on, is making sure you use sunscreen because of skin cancer concerns. England tends to be a cloudier place, so there's not as much sun, more vitamin D deficiencies there. So that might be part of the reason they went ahead and recommended that. But here in the U.S., not a recommendation. That we just don't need it.
If you have a underlying health condition, could you definitely get hit hard with the virus, or could you not have as bad of symptoms?
So the question is, if you have underlying health conditions, are you definitely going to get hit hard if you get coronavirus, or can you still have just mild symptoms? The answer is yes, you still could have mild symptoms. You're not necessarily going to get hard, but statistically, you're more likely to get hard, and that's the main difference. Get hit hard, that's the main difference. Because if you do get coronavirus and you have those underlying pre-existing medical conditions, then you're less able to fight off coronavirus. Your immune system is not going to work as well. And there's some reasons we don't quite know why it's affecting them more. And we're talking about people with kidney issues, heart issues, lung issues. High blood pressure is a big one as well, obesity. Those people are the ones that tend to get hit very hard with coronavirus, but not everybody that has one of these conditions will get hit hard with coronavirus. That's a big distinction. So we don't know why certain people get it and get hard symptoms. We don't know why certain people get it and get easier symptoms. We're going to learn that as time goes on. We think there's a genetic component to that, but having these pre-existing medical conditions certainly puts you in a category of being more risky, and you certainly need to be more careful.
Is it safe to go to the dentist?
Is it safe to go to the dentist? That's the question here. And actually, I just interviewed a dentist last week asking the same question. And the American Dental Association is saying, yes, it is safe to go to the dentist at this point for a couple reasons. One is the dentists have really done a lot to try and make it as safe as possible in their environment. Number one, they've started at the beginning. So when you have your appointment, they're going to have you come in, fill out some paperwork, take your temperature, take other measures to make sure you don't have coronavirus. They're going to take you straight back to a room. They're not going to have you in a waiting room with other people. Everybody in the office is going to be wearing some kind of PPE to protect you. On top of that, once you get in the exam room, they've gotten rid of some new technology they had. One of them being the tooth cleaner that can basically aerosolize everything in there, including the virus. And so since it can aerosolize the virus, which means it's more likely to hang in the air for a while, they've gotten rid of that. So they're going back to the scrapey kind of tooth cleaning that they've been doing for decades. And so even though people don't necessarily want that, it's something they're doing to keep everybody protected. On top of that, they might do what's called a dam in the mouth, which is a rubber dam they put in there just to isolate the one tooth. So if you're breathing, you're not breathing directly onto the dentist himself. And so they're taking all these measures to keep you safe. So the answer is yes, it is safe to go to the dentist right now. You just need to make sure you call ahead and ask them how you're going to be walked through that program so you can do it appropriately so you can stay safe, they can stay safe, and you can get your teeth cleaned.
What about church? I'm a very religious person. I'm concerned about going back.
So the question is, what about church? So they're very religious. They want to go back to church, and I completely understand that. The name of essentially here, what you have to think about church, like any other large gathering, is how can you stay safe in that environment? And the recommendations are, if you do go to church, the church itself should make sure that everything's social distance. If you're with your quarantine team, if you're with the people you live with, you can stay in a group with them, but for everybody else, 6-foot distance is important. The hugging, the handshaking, the kissing, all that needs to be put on hold for a while, as well as the sharing of things like the communion host, the wine, those types of things should not be shared because, again, you have that contact possibility of getting the virus. You want to be very, very careful. So, again, it's not the going to church part, it's the large gathering part that's a concern. If it can be done outside versus inside, it's safer that way. But again, social distancing, wearing masks, and keeping things from sharing are the important parts that are going to really help out here.
Do you think that schools will be opening up in the fall? What should we be looking for so our kids are safe?
So the question is, do I think schools will open in the fall? What should we be looking for so they can stay safe? I do think schools will open in the fall for one big reason is because we really need to get kids back into school. Part for their mental, their schooling, upbringing, making sure that they're doing well there. The other part is for their social development, making sure they're doing okay there as well. And so getting them back in is very, very important. But the CDC has come down with some very specific recommendations on what to do there. And this is, again, social distancing, wearing masks, a lot of hand cleaning, those things that you keep hearing me repeat over and over again. On top of that, they also say, a lot of health experts are saying a lot of creative thinking needs to be done here. And it might be that you go to class twice a week, Monday and Wednesday. Half your classmates go Tuesday and Thursday. And on Friday, it's a stay-home day, and you get long-distance learning like we're doing right now. Recess might be a little different than it has been in the past because you're not going to get the whole school group together. Lunch might be in the classroom instead of the lunchroom. Just to keep people isolated, it might be prepackaged lunch instead of the regular cafeteria type of lunch. But getting kids back to school is going to be important, but getting them back to school safely is going to be equally, if not more important, and they're working on that right now. I think come August, September, when kids do start going back to school, I think you'll see a lot of safety measures in place. I know you'll see a lot of safety measures in place to keep them safe. Also tracing any kind of contacts that might come into anybody who tests positive in the school, whether it's a student or a staff member. It's going to be equally important. And I think surprisingly, this is probably going to be the one time that students are actually going to want to go back to school because they'll be able to see their friends. This might be a unique time in the history of your family. So. But again, we talked about a few things here. One, lots of questions, which are fantastic. We talked about all the reopenings and the fact that with reopenings, there's concern about upswing in cases, so we all need to be very, very careful with that. And then New Zealand, how they did a great job of keeping things under control. Not necessarily everything could be duplicated here because they're a small island, but at the same time, there's a few things that might help out. In the meanwhile, for the rest of this week, just kind of keep an eye on cases as they start going up. So make sure your community is staying safe, make sure you're staying safe, and make sure you're keeping your family safe. Thanks a lot.